Hi, everybody. This is Dr. Eliana Aaron, Director of EMA Care. I hope everyone's doing well and staying safe. Today, we're going to talk about a few topics that have come up a lot with the people who are following this group. Number one is we're going to talk about how to plan a safe event or Simcha so that your guests feel safe and that you know that you are protecting them and yourselves. That's number one. Number two is we have a couple of questions about haircuts and going to the dentist. And we have another question about attending a wedding outside the country, people coming in, that kind of thing. So let's get started. So first of all, very important to realize that as Israel is determining what to do about the upsurge that we've seen in the last couple weeks, certain things are not going to be open. This was announced today. The movie theaters, the cultural things, those things were coming up in the next week or so. And the government has decided that they're going to postpone opening those things up because they need to control what's going on right now. On the other hand, they decided that events of up to 250 people will be allowed. And social halls will be opened up, etc. So weddings can go up to 250 people. Until now, we've been at 50. So that's quite a big jump, especially considering that that we have this upsurge. So, and as some of you know from my previous video and postscript of that video, is that we ourselves had my grandson's Bris today, actually. And I obviously had to give it a lot of thought over the last few months because we knew that we were going to have a Bris. We actually had to do a lot of thinking of how to make this Bris safe and how to make sure to manage our food, our guests. 2 months ago, it could have been that we would have had 10 people at the Bris. As of today, before this announcement happened, we were allowed to have 50. So first of all, we decided that we did not have to have 50 guests, that we were going to cut that down to immediate family. Thank goodness, immediate family is quite a nice number of people, but we had about 30 people. But a lot of the things that I'm going to talk about can be applied to larger events as well. My company, for example, we are doing coronavirus supervision, which is required by law at any event or any public building or any business. There has to be a corona officer who's making sure that the regulations are actually maintained. So we actually do that privately at a very high level, obviously, since we're health providers. We pretty much know very well what's going on with the pandemic and preventative measures. So I'm going to go ahead and share my screen so you can see some of the pictures of what we decided to do to keep this safe. So we did rent a hall because the option for a small simcha like this is renting a hall or doing it outside or in my garden. So when you're dealing with a lot of people who are there, you have to think about the size of your house and the ventilation and how many people could you really fit in and still be able to maintain a 2-meter distance between people. And the answer is not that many, even in a big house. So the option for being outdoors was not really there either because it was 92 degrees today or 32, 33 degrees Celsius. So we had to do it inside. We had to have air conditioning. And there wasn't a choice. That's also, a health risk. Everyone feels dehydrated when they're outside. So as you can see here, what we have is we rented an ulam or a social hall, and we divided the families up. So in the case of a bris milah, you have the father and the mother's side of the family, and we separated everybody into family tables so that the people who are at that table were part of the immediate family of those people so that they can share food, pass food, and sit near each other without a 2-meter distance. So what we did is we had this side of the room was one group of families, and we divided that up into 2 tables, and this side was another 2 families. And you can see here that people are maintaining a distance from each other, and so you can actually see people were not crowding in. This is when we were initially setting up. And what you see here is we had an isolation table, which was for people in the family who were very high risk, which is elderly or pre-existing conditions, that kind of thing. These are not the people, by the way, but I wanted to show you that we did have a completely separate table. We also had, for this table, we actually had an air conditioner above them, and we had open windows on the side. You'll have a better view of that shortly. But basically, we don't want to necessarily have an air conditioner blowing higher risk, blowing towards higher risk people. Rather, we want it blowing away from them. Okay, so if I had people here who were young adults in that, or teenagers that are in that initially dangerous group of spreaders, which we now see with the high schools and everything, I would not have them here and the elderly people nearby, because that would not be smart. This is our Kisei Eliyahu, and we could see the windows are open here with screens. And then this is the door to come in, and we actually use this table very well. Now, every surface of this hall was wiped down with antimicrobial wipes, okay? So that means the switches for the air conditioning, the light switches, the door handles, which we kind of continuously wiped throughout the event. All the surfaces were wiped and then covered. You can see here there's a tablecloth. And we have all different kinds of supplies in case people need those supplies. So what did that include? So we have here, we have alcohol, and we have a liquid alcohol hand sanitizer used for medical personnel. Some people prefer that to the alcohol. We also have an infrared thermometer. Most people, when they go to a store, they're holding the thermometer like this far away, and it's not accurate. You have to hold it like pretty close to the person, so usually within an inch, so about 3 centimeters or so, and that will give you an accurate temperature. I also screen people with a pulse oximeter, and that's that little device that you put on your finger that tells you how much oxygen you have, because we know that asymptomatic people, or people who initially present asymptomatically, it turns out that their oxygen levels are very low. We've had discussions about this before. We don't have to talk about it again. So we did have that. So when people came in, they waited by the door. I first of all had them put their phones away, and I did give them alcohol wipes afterwards to clean their phones with. So everyone had a clean phone, because you can't tell people don't use your phones for 2 hours. So we gave them alcohol wipes, and everybody had to wipe down their phones, and they did. They stood here at the door, and I spritzed their hands with alcohol liquid, and then you have to basically do this a lot to get that to be absorbed, because it's very liquidy. I then took their temperature, and I did their pulse oximetry, and if they passed those margins, which everyone did, then they were allowed to come in, and they had to have a mask on covering nose and mouth the entire time unless they were eating. What else I have on this table, I have the alcohol wipes here that I handed to people for their phones. I also have gloves. If people want gloves, if we had to clean something, we had to wipe down like the refrigerator door handles, all of the faucets, the Netilat Yadayim cups, all those things had to be wiped down with antimicrobial wipes. We had a lot of antimicrobial wipes with us and a lot of spares, and everyone knew that they can come and take if they needed it. We also wiped down the bathrooms, including even the soap dispensers. Everything was wiped down, and this was a very, very clean room. We also have these wipes. These wipes are a lot less liquidy. They are alcohol wipes, but they're very big. And so I actually used that because the Mohel came with a leather briefcase. And if I use an antimicrobial wipe, it can damage the leather. So I actually brought alcohol wipes to wipe down where he was going to touch after I sanitized his hand. So that was the locks and the handle and the areas that you touch to open it. We wiped that down. So that's what we had here, and that's how people came in. And it took about, I'd say like 30 seconds a person to screen, not too bad. And we also divided, all of the food was divided up into platters for tables for people who were in the same family. If we have people who were not in the same family, then we would have to make them individual plates. So what we did is we asked the food company to give us trays of pre-sliced vegetables and other kinds of things. Everything was ready to go, and we provided a lot of extra knives. It's hard to see here, but there are a lot of extra knives because there's cream cheese on the table, and we don't want everyone, even within the family, we want people to have the option of having their own knife to take food with, and all the different forks. So everyone was using separate serving utensils for everything, which is really nice. If they wanted to, again, if it's your core family, then you don't have to, but it depends. Sometimes it's not a cousin. We didn't have any cousins, but aunts, uncle, that kind of thing. And all the bagels that we had were wrapped and pre-sliced, which, they initially in the company that made the bagels didn't want to do that because they get dry. The bagels were fine. But when you slice bagels, you need to have one of those nice bread slicers. And I don't have 30 bread slicers. And I knew that that was going to be a source of potential infection, which is everyone sharing the same bread knife. So we decided to go ahead and do it this way. And it worked out really, really well. So we did that. Also, wait, I want to say one more thing. All the chairs. So if you think about when you sit down on a chair, you pull the chair out, then you sit down, and then you kind of tug the edges to pull it up again, okay? So all those places that people touched chairs were also sanitized. So the chairs, every chair was wiped down, okay? So we were really very careful. So as a joke, my daughter's sister-in-law and her husband, and yes, her nose was covered once she came in. This is them at the door. They brought urine samples to sort of make fun of me for screening everybody. It was apple juice. It was kind of funny. I thought you'd appreciate the humor. And you can see here, this is the actual bris that the crowd is spaced out around. The only people who had to be closer was actually passing the baby back and forth. And you can see here, the baby obviously doesn't have a mask, but you can see here, everyone is very carefully covering their nose and mouth. I just wanted to show you another view. Also, here you have a toddler. Toddlers cannot socially distance from anybody, so don't fool yourselves. Washing their hands is really important, keeping them clean, but they touch everything, they lick everything. They want to be held by strangers. They want to be held by everybody. So, we know now that toddlers don't spread the disease, but as much. They do spread it, but much less than young adults do. But keep that in mind. It's not realistic to think that a toddler is going to be able to stay at a table where you want him to stay or her to stay. So you have to keep that in mind. And here you can see, this is the bris milah happening and how people were keeping very separate. This is here, the mole is all the way over here. That's a full 2 meters away. And this is the sandik. And this is the mother after the bris. Again, even the mother had to have a mask on. And this is a family photo. Now, someone asked me if family photos, and of course, this is the end result of the bris. That's me with my new grandson. His name is Levi. What we have is we have a question that people said is, do we have to wear masks for the photos? The answer is no, you don't. That's insane, okay? But where you take the photos should be far away from everybody else, okay? And shouldn't take too long. We actually waited to take a photo without masks when everyone else had left. And then we had this nice photo and we all had our masks off. And the person taking the photo was also part of the family. So it worked out pretty well. But you don't have to have you have to have it has to be rational. During a ceremony like a wedding, people are wearing masks. Yes, they have to wear masks. You know, unfortunately, that's life as we know it right now. It's not as nice as we want, but it is reality. And the grandchildren will look at it and say, "Oh, that was a Corona wedding, really cool." None of us want to do this, but if you are taking photos of your family and you are the only people, you know, they usually separate the families. Okay, now the Kala's family come in. When it's your family and you want to take your mask off, that's fine. The photographer needs a mask and he needs to be at least 2 meters away. So remember, he can focus in, he can get close-up shots, but the family itself does not have to wear masks when they are together as a group and not near other people, because remember, they're living together. So you have to be rational. Just because you are in a Simcha doesn't mean that there's no opportunity for you to have pictures taken separately. No, you should not have pictures in the hall with people running back and forth and everything. No, that should not be without a mask. So you have to be rational about that. So is it possible to have a great Simcha that's also safe? And the answer is yes, you absolutely can. Some of the things that I talked about, actually just about everything I talked about is applicable. All right, we do not have a buffet. There has to be plating at the table or family clusters. Both of those options are good. You need to have a mask on unless you're actively eating and drinking. So if you finish eating and drinking and you're just sitting there, that's not going to work. You need to put the mask back on. And people were very careful. And everyone who came felt initially, before they saw how it worked out, they were skeptical that they were going to feel comfortable and safe. And everybody felt very, very safe. It's not fun to wear a mask all the time, but when you see everyone doing it, then you feel like, okay, you know, at least we know we're safe. This is a safe event. How do you dance? So first of all, it's recommended for high-risk people not to dance at all. Secondly, I personally recommend that anybody who's dancing gets a squirt of alcohol and has to clean their hands. And then after they dance, they have to do the same thing. So you pretty much have to go around and squirt, 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 and get everybody hand sanitized to keep the place safe. So these are things that are important. I had extra masks. I didn't tell you about that, but I had extra masks in case a mask got wet or dirty, or if a mask didn't fit properly. We had a situation where a mask didn't have a metal band, and so we went ahead and gave them a spare mask that had a metal band and was, you know, an excellent quality mask. So we had that available. We were actually like, here, take a squirt a little bit. But once they're in the room and we know their phone is clean and we know everything they touch is clean, you really don't have to worry that much, okay? Now the little kids who are picking their nose and, you know, coughing and spitting everywhere, yeah, you gotta wash their hands more, you gotta keep track of it. But again, those are not the super spreaders. So we have to keep that in mind also. I'm gonna answer a couple of questions. Number one, I am a family doctor in Beitar. My daughter's getting married in August in the States. Can we get permission to leave for this event if you're a healthcare worker? And do you think the restrictions for doctors will lift when other restrictions are lifted? That's a really good question. I don't really have a fantastic answer about that. I think that there are always exceptions, and there is a ban for medical personnel to leave the country. Certainly, getting permission to attend your daughter's wedding is a great reason, and I'm pretty sure that you can apply and get, they're not going to deny you the ability to leave, as long as you're not, you know, abandoning the country and you're the head of epidemiology and Misrata Brit, you know, Ministry of Health. So I think that that there are exceptions. There are exceptions, and there have been exceptions throughout this. And Israel, if anything, you know, the most positive thing you can imagine, and you know, is Israel is a very family-oriented country, and that they want people to be able to attend weddings. So they even let people who live outside the country come into Israel as tourists to attend immediate family member weddings. So That's been allowed. Of course, there is a 14-day quarantine, but I don't see any problem with this. You will have to quarantine, obviously, when you get back to Israel. Another question, what's your opinion about taking children for routine dentist appointments in a place where there might be a breakout? And are the dentists taking enough precautions, et cetera, et cetera? So my advice about going to a dentist, a doctor, even during the peak of our activity here for coronavirus in Israel, it's important to communicate with the staff of wherever you're going. You say, are you wearing masks that cover your nose and your mouth? Are you, checking everyone's temperature when they come in? Are you making sure that we're not in a crowded waiting room? And by having them answer these questions, you will feel comfortable to make an accurate, knowledgeable decision, an informed decision about whether it's safe or not to go to the dentist. If a dentist is, in fact, wearing a mask and changing the mask, because remember, when you clean teeth, things spritz, okay? So that mask will need to be changed frequently. Now, I suggest for people who have jobs like that to have a face shield on top of the mask so you don't have to keep changing the mask. And the face shield will get spritzed, and then that has to be cleaned between people, or else it's going to get really gross. But that's the point of it, to see the problem, to clean it, and then it's clean. So I think those are things I would advise, so you can make an informed decision. I always assume, and it's not because I'm a negative person, but I have to assume that lots of people anywhere I go have coronavirus and maybe don't know it. So whether there's an outbreak or not an outbreak, or maybe an outbreak and the school's closed and that kind of thing, it shouldn't make a difference, because these restrictions should protect you no matter what. And that's why you need to ask the right questions, okay? Next question. Thank you very much for your epidemiological updates. They're smart. My question is, are there any reliable statistics regarding reopening, like the safety of going to hairdressers or a barbershop? What do you think about venues that don't have a lot of people? Okay, so again, I'm going to give the same advice that I gave just now about the doctor. Before you go somewhere for an appointment, I'm not talking about a clothing store. If you go to get your nails done, you're going to get your hair done. These are things that are important for people who it's important for. It really helps their mental health, well-being, and for women in particular, maybe to feel good and to look good are very connected. So these are actually important things. I wouldn't say like during the full closure that this was an emergency, no, but it is something that people after 3 months kind of feel like, I can't look in the mirror anymore and I really want to go somewhere to get my hair done. Especially if you're older and your gray is kind of growing out, and that can be disturbing to people. So my answer is, and this is what I have done, and I have gotten my nails done and I've also had my hair done. So I've done that in the last month or so, is you have to call, you have to get your information. What are you doing? How are you making sure it's not crowded? How many people are you gonna let into your store at the same time? What do you do if someone comes in without a mask? What do you do if someone comes in and their nose isn't covered? And I ask them these questions, and if I'm not satisfied with the answer, I don't go. And that's my decision to keep myself safe. But thank goodness the places that I want to go, they've been very, very careful, and I go there and feel comfortable. They leave the doors open and there's lots of air, and they only let 2 customers in at a time, and they're 2 meters apart from each other, and everyone's wearing a mask the whole time. And they even cut your hair with your mask on, and they learned how to sort of get around the earpieces. So I think that's really important, and that's a rule that I apply to everywhere I go, pretty much nowadays. And if I'm not comfortable, I don't go in. And I've heard a lot of crazy excuses. I've seen a lot of crazy things, believe me, but I'm not going to be patronizing a place if I don't feel safe, especially if it's a place where I have to go in and I have to wait there. I have to stay there for a while. If I go to a dentist, I'm in the waiting room. So the more exposure I'm going to have, the more inquiries I'm going to make. I am not going to call a supermarket and say, well, what do you do if? Because if I'm going to a market and I'm running in and I'm running out, I actually do almost all my shopping online, so this doesn't so much apply to me. But if I have to go to get milk at the local shop, okay, I'm not going to call them every time and say, so what are you doing about this? Or what are you doing about that? I will say, okay, I'm going in. I have 3 things to buy, and I am going to make sure that I am not near people. And I go, and if people come near me, I say, Slicha, excuse me, please stay away. I need 2 meters. What kind of also works for me is I tell them I work with corona patients, and that kind of scares them, but whatever works. But I think that that's important to take care of yourself, okay? I hope this has been helpful. I hope everyone stays safe, and I'll be answering questions. Please send them to efrat@healthcareisrael.com, or she's also one of the administrators on the WhatsApp group, and I'm happy to answer your questions, and I hope this has been helpful for you. If you have topics that you'd like me to cover, I'm happy to do that too. Take care.